So this is regarding sample receiving, that what all we should check for sample receiving, and I just want to see that how ChatGPT can help us and what all it can tell us. In short, because checking books every time is little difficult, so I have given the instruction that it should follow all the national guidelines and CLSI guidelines. So, sample receiving is one of the most critical steps in the total testing process because many laboratory errors occur before analysis. So, if you are head or if you are professor or if you're senior microbiologist, your aim should be to ensure that the right specimen from the right patient reaches the laboratory in the right container at the right time and in the right condition. So this is very very important because for microbiology contamination should not be there. So at each and every step we have to see that it should be a pure thing, and it should be a sample from which we can find out or we can isolate pathogen. We don't want contaminants or commensals. So general checklist for sample receiving, all the for all the specimens. So for all specimen, what we have to see that patient identification should be clean and clear. That is the patient's name on the container identical to the requisition or the LIS. So it should be same. We should cross check it. Is the hospital registration number, that is UHID, it should be there, and whether it is correct or not. So again cross checked. Is age or sex mentioned? Is the sample collected from the correct patient? So everything is there, but the important thing is whether it has been collected from the right patient or not. So you have labeled it correctly, but it is coming out from the other patient. This may also create problem. So reject it if unlabeled specimen is there, if mismatched identifiers, or if wrong patient details was there. So clinical information, check provisional diagnosis, relevant symptoms, any antibiotic history, ward ICU and ICU location should be mentioned because that shows the severity of the patient. Also, reporting is little different for different places. Date of admission, treating consultant, this all is also very very important. And one more thing here I would like to see if the sample is there, time is also very important. Time of collection of sample is also very important, especially for the microbiology lab. So we should ask our PG that why is clinical history is important for microbiological interpretation. Many things I have told you. This we can also, because it is again a big point, an important point. This we can discuss in the other thing, that why these all things are important. But we should go step by step. And coming to the specimen details, so check if what is the type of specimen. Urine, blood, CSF, sputum and pus, these are the common samples. Other may also be there, like many fluids. Anatomical site, what was that anatomical site from where it has been collected, like wound swab from right foot or left foot, so this should be mentioned. Date and time of collection, that is what I just wanted to tell you. The date and time of collection is important. Collector's name, because if you find any problem, then you can directly ask with that patient. And so we should have this name. I will try to add this thing in my college because it is not there. So I in LIS it is there. Yes, I think they have added it now. So container check, correct sterile container, leak proof, no cracks, proper cap, appropriate transport medium if needed. So these all things are very very important, and they have reason for it, because it should be leak proof. Leak proof because we want proper amount, otherwise it is risky for the person who is bringing it for you. So proper cap and all these things should be there in the container. Then quantity is the volume adequate, because that is very very important. In case of urine, you want 10 to 20 ml. For CSF, adequate volume should be there. For blood culture, it is very very important, because you have to maintain the blood to broth ratio. Then pus is also important. Enough material for microscopy and culture, and whether it is swab, whether it is the pus itself. So this is important. Then coming to the transport, that should be checked in case of specimen collection. Like transport delay was there, appropriate temperature was maintained or not, because during that any organism, fastidious organism, they may be killed if you won't follow that guideline. Then correct transport medium should be there, then only it can maintain the viability. So specimen not dried or spilled, acceptance or rejection. Should this sample be accepted? Now you think that yes, it is, everything was proper. If rejected, what was the reason? You should know that. Has the clinician been reported that this we are going to reject, and this was the issue? So either send the other sample, otherwise you won't get the right report. So sample specific checklist. For example, if it is urine, so what all important thing you should check? Whether it was midstream clean catch, whether it is catheter sample correctly collected or not. Is it? It should not be from the urine bag. Sterile container should be there. Received within 2 hours or refrigerated, or adequate volume is there or not. So how can you reject? Where you should reject? If the urine is from the drainage bag, then you should discard reject it. If the container was leaking, again discard it, because it is sterile, we don't want any contamination. Delayed unrefrigerated specimen, so this should also be rejected. Then blood culture. In case of blood culture, first thing what you should check is correct blood culture bottle, skin disinfected properly or not, adequate blood volume, collected before antibiotics or not. Then bottles not shouldn't be overfilled or underfilled. Proper labeling should be there. Prompt transport should be there. So why is volume the single most important determinant of the blood culture yield? This is important, and your PG should know about it. Yes, I think it is an important question. Many other things can be asked, but this can be asked. And sputum, in case of sputum, early morning specimen should be collected. Deep cough, not saliva, should be taken, because we want the organism, and that too in the from the lung secretions. Then sterile container should be there. Prompt transport should be done. Laboratory clue is excess squamous epithelial cell. If there, you know that there is one criteria which we follow. This can be discussed with the postgraduate students. And so repetition of why we should involve teaching there, why we should ask these questions, because if you keep repeating the things, revising the things, this is for everyone. This is for all those people who are not directly now involved in learning. So just by teaching you can remember everything. So this is important, and this criteria should is very very important. So we should keep repeating and revising and asking from the postgraduate students. Now coming to the pus or the wound specimen, aspirate is preferred over the swab. We know that, because swab dried up easily. Then deep tissue specimen is there. If it is deep infection, then what is the site from where it is collected? Then anaerobic transport, if indicated, then that should be done. So if it is a dry swab, then rejected. That is what I told you, this dries up easily. Then unlabeled site, if they have not informed you. Then coming to the CSF, which is a highest priority sample because it is related to brain infection. Immediate transport is important here, no refrigeration because it has fastidious organism and they don't like lower temperature. Then adequate volume should be there, so proper culture and every other thing can be done. Sterile tube and time of lumbar puncture should be maintained. Then we should ask that why should CSF never be delayed? Why it is so important? Because of those organisms which are present most of the time in the CSF, and they are very fastidious and fragile. So we should, the PG should know, and they should always, if CSF or these type of samples are coming, then they should know the priority of processing. Stool, you should look whether it is a fresh sample. No urine contamination should be there. Carry Blair transport if delayed should be used, and quantity should be adequate. Now coming to the swabs, we should check for site. Site mentioned, appropriate transport medium again is important. Then moist, it should be moist. If it is a swab, it should be moist, not dried, otherwise you won't find the organism. Prompt transport should be done because of this reason. Body fluids, plural, ascitic or synovial fluids, then we should again see whether it is a sterile container or not, because these fluids are sterile, so we cannot get mixed type of infection here. And adequate volume, aspirated specimen preferred, immediate transport should be done. So if you are the senior microbiologist and you are doing audit, then what questions during sample receiving should be asked with the technicians? How many samples have been rejected today? Because this is not a good practice, something is wrong, and training should be done for those people who are collecting it, transporting it, or receiving it. So what were the common reasons for the rejection? So where the problem is, this you have to find out and then fix it. Which specimens require urgent processing? So they should know it, then only they will follow the order. Which sample came from ICU and ICU? Today it is very important, because these organisms, these antibiotic sensitivity should be known to everyone, because these are serious cases and they should be tackled with priority and seriousness. Are any blood cultures delayed? Any leaking specimen is there? Any mislabeled sample is there? Any high risk specimens have been tested in the lab? So these type of things should be asked, and if you make the cross list or the checklist, then it is also very important, because nothing can be missed then. Common rejection criteria: reject if the sample is unlabeled. Why so? Because that risk, patient safety risk is there, you don't know whether it belongs to this particular patient or not. Then leaking container, this may lead to contamination and biohazard. If it is a wrong container, invalid test result. Then inadequate quantity is there, reject it, because it may lead it to insufficient for this is not good for proper reporting, and insufficient for testing. Excessive transport delay, reduce the pathogen viability. Dried swab, poor recovery of the organism again. Duplicate specimen without indication, unnecessary testing. So why we are getting again and again the same thing? Improper storage, altered microbiological results, because you don't know whether at that particular temperature the pathogen will survive or not, and what you are getting is just the other organism. So teaching point for residents here can be, during the round we should ask whether the specimen using these 5 keys, that is the patient, is it the right patient, is it the right specimen from the right side. So this thing this person has to take care of, that whether was it collected correctly and in adequate quantity, Was it transported promptly, and other appropriate conditions were maintained or not? Should it be accepted? At the end, he should think now, just by looking at all these points, he should think finally whether it should be accepted or it should be rejected, or if it is done, why you are doing it, and it should be properly documented too, because this is very very important for these days. So this systemic approach, if you follow, you improve your diagnostic accuracy, you support the antimicrobial stewardship and complies with the NABL quality requirements. So this all is about the checklist for a specimen, what all we should take, we should care about the specimen. We should ask, our PG should know, our technician should know, and other things can be added whenever you find something special that can be added to it. So these are the, I think it is a good checklist as given by the uh, chat gpt, and we should uh, add according to our lab anything whatever we feel that can be added to this list, and it can be improved according to the uh, teaching conditions or training conditions, or your processing or testing and reporting conditions of your lab. So this is all about it. Next we discuss the next topic, and we keep on discussing and learning different things for the various labs. So thank you very much.